My name is Dr. Ankit Patel. I'm an associate dentist and facial aesthetic practitioner at 21Dental. So today we're going to get in a patient for his Botox treatment. What we're going to do is address his concern. Once we've addressed his concern, I'll go explain a bit about why this is occurring, how Botox could potentially benefit him, and then I'm going to go over the risks and benefits of the treatment. Botox has been used in medicine for a number of decades and has been used safely within aesthetic medicine for over 25 years. Botox is basically used to reduce muscle hyperactivity. So it's basically used to reduce the formation of dynamic lines or lines we form on our face when we make certain facial expressions. The common areas we treat with Botox is our frown lines, our forehead lines, and around the eyes when we smile, typically called crow's feet. But there's other areas that can also benefit from Botox. Now there's a couple of reasons why these lines form. So the lines we form when we frown and the lines that we form when we smile around here, these are typically called depressor muscles, and they basically function to move our eyebrows inwards and downwards. Now the muscles that we use to raise our forehead are called elevator muscles. So these will elevate our eyebrows. When we're in our teens and 20s, there's a balance between these elevators and these depressors. But as we get older, what typically tends to occur is the depressor muscles become hyperactive, they become enlarged, and they will typically pull the eyebrow down and inwards. Now, because of this hyperactivity and the muscles pulling the eyebrows downwards, we tend to compensate by raising our forehead up and simultaneously forming the horizontal lines. So what we try to achieve with Botox is not to reduce or eliminate any facial expression, but it's to correct the hyperactivity and create a balance again between the elevators and depressors. When we apply the Botox, the effects don't occur straight away. It will typically take about 4 to 7 days, and it will typically last about 3 to 4 months. So when we do Botox for the very first time, we will give typically a standardized dose, and we will then review you after 2 to 4 weeks when the Botox is at its maximum to see if we need to make any alterations to get the best effect.